Hello medicos, today we are going to see about ketamine. Ketamine is a very unique and specific drug, and it has so many special characteristics in it. This one not only in the OT, not only for anesthesia purpose, we are using this ketamine for so many good things, and this is having so many advantages over psychiatric treatments. Ketamine therapy also is there, so it's very useful, and it's very important drug in this medicine world. So ketamine is a amnesic, sedative, and hypnotic and analgesic. So in this ketamine there is analgesic property. So this is a unique character for this, okay, because we saw already the induction agents propofol, etomidate, so thiopenton, these and all, there is no analgesic effect. So only ketamine is having analgesic effect. So this is one unique character of this drug. So what is injection ketamine? This is a non-barbiturate. As I say before, it is induction agent, like sedative, hypnotic, analgesic, and amnesic drug. So it was synthesized by Stevens and Detroit in 1962, but when it came to use in humans, 1965. Okay, so first time they used in humans 1965 by Carson and Domino. Okay, by Carson and Domino, and it's creating dissociative anesthesia. So what is dissociative anesthesia? We are going to cover everything today. So the properties, it's a phencyclidine derivative, and pH is a 3.5 to 5.5. It's a basically acidic. Okay, then preservative benzidonium chloride is added. Okay, then the dose and duration. The dose, it will be like IV 2 mg per kg, but IM 5 to 10 mg per kg. See, there is a unique property for this also. We can give this one in IM, IV, rectal, nasal, oral, intrathecal. So many routes are available to administer this ketamine, but we cannot give propofol and thiopenton and etomidate. We cannot use these drugs for IM, okay, because it will irritate. So we cannot use. Only IV is a preferable. So ketamine is very special and very unique for this also. We are getting available concentrations 10 mg per ml and 50 mg per ml. Onset of action, it will be in 60 seconds. Okay, so it's like other induction agents. So this is also in 1 arm brain circulation timing. So it's very fast, rapid onset of action. If we are giving IM means it will take 5 to 10 minutes. Okay, for the onset. And duration of action, when we are giving in IV, it will stay, the action will stay around 10 minutes. Okay, 10 to 15 minutes. But when we are giving IM, it will stay 20 to 30 minutes. And the half-life it will be 2 to 3 hours. So now the mechanism of action. See, the mechanism of action is different from propofol, etomidate, and thiopenton. Why? Because these ketamine is creating dissociative anesthesia. How it's creating dissociative anesthesia? Because it's acting NMDA antagonist. Okay, so this ketamine is acting as a NMDA. NMDA means N-methyl D-aspartate. This is the full form for NMDA. So this ketamine is acting as an antagonist in NMDA receptors. So all NMDA receptor antagonists will give dissociative anesthesia. So it will create dissociative anesthesia. What are all inhibited by the ketamine? Cortex, it's responsible for unconscious, and thalamus, it's responsible for analgesia effect. So these are all inhibited by ketamine, and the limbic system is stimulated. Limbic system is responsible for emotions, memory, and so many things. Okay, so these all are stimulated. Okay, because of this limbic system is stimulated, we are getting this dissociative anesthesia. So for a brief, we will see what is limbic system. The limbic system is a group of structures in your brain that regulate your emotions, behavior, motivation, and memory. While small in size, your limbic system has a big job to help you interact with the world around you. So just imagine when we are unconscious, okay, so our body we cannot move, and our we are not we cannot see and we cannot speak, so we cannot do anything, but our emotions, this memory, this system is stimulated. So what we will do, so we cannot do anything as a physically, but we can be in some other world, and we can imagine so many things, and it will create so many dreams, vivid dreams, in hallucinations. So this is because this limbic system is stimulated, okay, by ketamine. That's why this dissociative anesthesia is happening while using these NMDA receptor antagonist drugs like ketamines. So we will see the systemic effects. So in CNS, it's creating strong analgesia. Why? It's inhibiting the thalamus. Okay, then it's creating the dissociative anesthesia. So that is, I just given here also, this cortical function and thalamus are inhibited and limbic system gets stimulated. So it's causing vivid dreaming, hallucinations, and emergence delirium, and it's increasing the intracranial pressure. Therefore we cannot use this one for head injury. So it's contraindicated for head injury patients. Why? It's increasing the intracranial pressure. Okay, then the systemic effects in CVS, cardiac. So in cardiac, it's stimulating the sympathetic system, okay, system. Therefore it's increasing the blood pressure, pulse rate, and cardiac output and all. So it's a good choice for in shock patients. Okay, then in respiratory, it's stimulating the respiration, increasing the secretions of bronchial, and we can use this ketamine for a full stomach patient. Why? It's preserving the laryngeal and pharyngeal reflexes. Okay, so these reflexes are preserved. So when the patient is in full stomach also, we can use this ketamine. It's little safer drug comparing to propofol and etomidate and all. And in gut, it's increasing the gastric secretions also, and it's increasing the gastric pressure also. Then the muscles, it increasing the muscle tone rather than relaxing, it's increasing the muscle tone. So when the muscle tone are increased, the muscles are very rigid and very stiff. We are playing statue games. So what we will do in that games, if one person is telling statue, we will not move our hands, legs and all, we will stay the same position, right? So same like that, when we are giving this ketamine, what is the position we are keeping, the same position it will stay. Why? Because there is a no muscle relaxation. So the same position, if we are keeping flexed knee, it will be in the flexed only. Okay, so the position it will be same. This is called cataleptic state. So now we will see the uses and advantages. So it will be easy to understand now the uses and advantages. So first, it's creating strong analgesia, not only in the large doses, in the small doses itself it's causing strong analgesic effect, and we can use this one for a full stomach patient, and it's a very good choice and induction agent for asthmatics, shock and children. As I say before, it can be given IM also, so we can use this as an induction agent for children's. And we can give this a drug for pericarditis and cardiac tamponade, and safe to use in remote locations. If the anesthetist, or if they are not that much experienced also, they can use this ketamine. They can use this ketamine because it's very safe to use, and it's a sole agent we can use in the small procedures like minor procedure, burn dressings, so like that procedures and all, we can use a single ketamine. And for a depression patients, it's contributing too much, because when the first stage and second stage treatments and all are failing for the depression patients, it's acting as a strong and very good alternative for those medicines. It's acting as an antidepressant drug, and we are having the ketamine therapy. So many of them are came out from the depression because of this. Ketamine is very suitable for them, so it's act a good relieving agent for them. And the adverse effects and disadvantages also is there. Because of this is very good for the depression patients, so many of them are misusing this drug, and so many of them are addicting this drug. So we cannot use this drug for the who is already addicted for ketamine, because it will create so much hallucinations and so much dreams and all, and creating shouting and singing, like that patients will be so emotional after the anesthesia. This and all, it's disadvantages. And importantly, it's increasing the intracranial pressure, gastric pressure and secretions, and the intraocular pressure, and so many pressures in our body. It's increasing, and it's creating the nausea and vomiting also. So dizziness also is there. We cannot use this one for seizure patients, and like that and all. And it's increasing the muscle tone. So because of this, there will be some tonic clonic seizures also, and it's increasing the secretions, they say before. So laryngospasms will occur because of the secretions, and it's increasing the myocardial oxygen demand. The pharmacokinetics, it's metabolizing in the liver. Like a ketamine will be metabolized as a norketamine and hydroxyketamine, and excretion is metabolized products are excreted through the urine. The contraindications, it will be we cannot use for head injury patients, and we cannot use for eye injury patients, or ophthalmic pathology is there, means we cannot use. And ischemic heart disease patient we cannot use, because it increases oxygen demand, myocardial oxygen demand. And we cannot use these vascular aneurysm patients, because it increasing the hypertension. And patients with the psychiatric diseases and drug addicts, so we cannot use this one, so it will cause more hallucinations and in emergence reaction. And hypertensives we cannot use, and hyperthyroid we cannot use, but hypotension we can use, hypothyroid we can use. So these and all the contraindications. Hope this video it will help you so much. So whatever we are learning here, the same there is some MCQs available in our website, so just go through on that website, so it will be helpful for you so much, and it will give you the confidence to attend your exams and all. So in one drug we created more than 20 MCQs, so it will be very useful for you. Thank you so much. If it's useful, please subscribe and please share with your colleagues and juniors and who is studying in the colleges. Thank you so much. Take care. Bye bye.